The whole concept is good. I think we do need to have more specialized centers and services. But at the same time, we've got to be mindful of people accessing and traveling arrangements. So public transport needs to be very good. I think we all do want to have services which are of high quality, but at the same time, it is very important that we have then the follow-up, which is done either locally or in the community, needs also to be high quality. So the patient has to be followed up in order to get the best possible outcomes.
Well, first of all, I'm extremely supportive of the whole thing, having been involved since the back end of 2010 with the Acute Services Review and now Healthier Together, and I fully support what we're trying to achieve. Obviously, there's going to be discussion about some of the detail. Within Milton Keynes, although travel is important to everybody and has come up on regular occasions, within Milton Keynes it is probably different from any of the rural areas, because we in Milton Keynes can get to the hospital within about 10 minutes, whereas rural areas they're probably more used to travelling longer distances.
It is very good. It is good to ask us our opinions, as especially I'm the only disabled person in this group. So there are lots of concern for disabled people in the package. On the whole, it is a good model, provided there are some additions made to it. So as I was told, I hope it is very much a work in progress so that necessary adjustments can be made.
I think it's been good to hear what the plans are, what models they're bringing in, but I don't think it was detailed enough for those of us who are here for the first time, who weren't involved in the groups. I think they do make sense and I'm very supportive of them, but I don't think enough has been thought in terms of prevention, and particularly in terms of midwifery and health visiting. I don't think enough time was given to their role and how they can help to bring about this local involvement of people and patients, and providing community-based services.
I think the event today is important because it's the first time that the outcomes from the 5 clinical groups have been discussed. And it's very important that it's discussed generally before the models are tied down and completely set in stone. So the fact that they're bringing to the public and to the patient groups and to the community generally drafts of these models is important, so we get a first chance to have a reaction and a say and potentially to make some suggestions and changes and modifications.
It's really pleasing to see an event where we've got such a broad range of stakeholders coming together to contribute towards the programme we're undertaking. And the programme is trying to be on the front foot of trying to design healthcare services for the future, and it's vital we get the views of the clinicians, the local stakeholders, to make sure that we essentially get it right for the public. Pleased to see the focus on the community aspect and taking services out to the population in a way that is more preventative rather than always offering a cure in highly specialised hospital-based services, and we believe that will help keep people healthier and independent for longer, which is what our population regularly tell us. I think the proposals have started to take shape, and the clinicians have clearly worked hard on how they should look. I think for some of the services, it's clear from the reaction of our stakeholders today that there's really strong support for doing things differently, particularly when you look at things like cancer services, and I think people would like to go to the very best service that they can go to when their loved one or themselves has cancer. I think the other range of services, again well supported by a broad range of people, are starting to show how we would consolidate to bear in mind our staffing issues we have locally, the recruitment problems we have in certain specialties, to try and offer a more consistent 7-day-a-week senior consultant-led service in many of our hospitals.
What brings me to this event is what our service is all about is about the health and well-being of the clients that come to us, which absolutely fits in with this National Health Service event today. So it's about raising our awareness about how these things are going to progress into the future. I think on a couple of levels. One is it's about raising awareness about the future plans, but also a great event to get different ideas and perspectives from a whole range of different people from around the county. So there's a whole broad range, so from the voluntary sector, from members of the public, from governors, from clinicians. So it gives a whole different range of perspectives. So for that reason, it's very, very interesting. I've learnt a lot so far this morning, and I didn't come to the other events, so it's about raising my awareness as well about where they're at in their journey. I think what they're doing now is the right thing. I think it's about talking to different stakeholders. So that's not just clinicians, that's also the patients. They're the most important element to this. So I think more of these events, there's been lots of work that's been done, lots of publicity around the pathways. I think doing more of that and getting that message out about what they're doing. I think there's too much negativity around the service and the NHS. I think it's getting that information out there that there's a huge amount of consultation that's happening with the whole of the community and the clinicians. So I think it's getting that message out a lot more. And I think doing more of these events is the positive thing. So more of this, I think, please.
We're actually in uncharted territory. We've got a situation where we've got a rising population. Not only have we got a rising population, but people are living longer. Not only are they living longer, but actually also a lot of people will end up with multiple sort of things wrong with them. We've also got a situation where we haven't got enough NHS consultants to deliver the type of care that we need and deserve. So it's been called the perfect storm, but added to this is actually we've also got increasing cost of equipment, NHS equipment, so that we are able to provide the best possible care. We've also got increased cost of drugs. And actually we're in a situation where our budgets effectively within the NHS are actually reducing. And so what we need to do, and what the Healthier Together programme is all about, it's a strategic review where actually it's looking at how we can ensure that we can continue to deliver high quality and safe NHS services into the future. It's not a quick fix. We've actually had over 120 clinicians looking at that. These are the people who actually do the work and know what needs to be done. And so what we're looking at is an evidence-based review to actually create the framework going forward.